Here is a story that a lot of you have been talking about, not just to us, I'm sure, to your family and friends. All right, this is definitely what they call a talker in the news business. Dozens of unvaccinated legacy workers protested the COVID vaccine mandate today. See, nearly 800 people were placed on unpaid leave today because they won't get the shot. Governor Brown mandated, as you remember, all healthcare workers that they have to be vaccinated by the middle of October. But every healthcare system kind of has their own timeline, and you're seeing legacies play out. Many of these workers filed for religious exemptions, but they were denied. And a lot of you were asking us during Kristen's first story on this yesterday, how the religious exemption process plays out. How does that work exactly? And how can an employer deny someone's claim? Here's Kristen Severance.
I knew we'd get so many comments and questions after our story on the unvaccinated legacy workers being put on leave. And the story viewers did not disappoint. We read all of your messages, like this one from Greg. So he emailed saying, so I really wanted Kristen to ask the religious exemption person if he has had any other vaccinations. Greg said religious objectors need to be consistent in their beliefs. Thank you, Greg, for the email. So he's talking about my interview with a certified nursing assistant at Legacy, Joseph Steiniger. Steiniger works at Legacy Meridian Hospital in Tualatin. He filed a religious exemption instead of getting the COVID vaccine, saying it goes against his beliefs as a Christian. I asked Joseph if he's received any vaccine in his life. He said yes, he has gotten the flu shot, but then his beliefs on vaccines changed.
And that was when I started making a lot of life changes and trying to eat more organic and not genetically modified stuff and avoiding a lot of different toxins and got rid of a lot of cleaners.
You know, I've talked to several healthcare workers basically losing their jobs over this, willing to walk away. Many of them tell me the same thing. They say they have a right to change their minds, change their beliefs and religious views, and that their exemptions should not be denied because they have not felt this way their whole lives.
How do you prove that this is somehow religious and not just how you feel inside?
Well, in Romans, it talks about not eating anything that goes against your conscience. And that would be similar to injecting something into your body.
You hear that a lot when it comes to people filling out religious exemption forms. They say it, quote, goes against my conscience. But is that enough to prove that their beliefs are, quote, sincere? I asked Jim Oleski, a professor of law at Lewis and Clark Law School.
Well, the company certainly would get in trouble if they tried to tell the employee what is and is not a legitimate religious belief. If they did that, they'd get in a lot of trouble. But they are allowed to, and the government is allowed to, in cases involving exemptions from government rules, determine sincerity, because otherwise you can imagine the problem. If anybody could claim that they objected to any rule for religious reasons and government couldn't test it.
Oleski also told me the scripture being used on many of those exemption forms doesn't seem to be specific enough to hold up in court.
And at least some of the examples you gave me of reasons employees gave for objecting weren't specific to COVID-19. They were references to a religious belief that they shouldn't do anything that they think is wrong. Well, again, if someone's belief is that general, then it would be impossible to enforce rules.
We also talked to Steve Green, a law professor at Willamette University. He said employers have every right to ask if something an employee believes is in fact backed up in some way.
But still, you need to show there's some basis so the employer can at least respond to this, right? And so consequently, I could see a situation, and I know there's a situation, I think, at Legacy Hospital, where a claimant was rejected because they were not opposed to vaccinations per se.
And while employees and the Oregon Nurses Association said that Legacy did, quote, blanket rejections, meaning they just rejected every single medical exemption, Legacy told me that is not the case. They said a panel went over every exemption request form before it was denied. All of these unvaccinated employees will be placed on leave, but Legacy told me those workers have until October 18th to get even one shot, and they can still keep their jobs. Do you have questions? I know you have comments. Let us know. All you have to do is use that hashtag, HeyDan.
Okay, thanks to Kristen.